Beep, 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 beep. Go! Goo Goo Dolls, of course, on your hometown station, KHTS, 98.1 FM, AM 1220. Good morning. It's Hometown Morning Show with Tori and Kyle, 7:38 on this Tuesday. Southbound 14 at Escondido. Looks like they're doing some Caltrans work. That might hold you up a bit. Southbound 5 at San Fernando Mission. We had a crash there. And boy, that 14 and 5, a mess getting out of Santa Clarita this morning. Both. The 14 at San Canyon, the 5 at Calgrove, and it is just bumper to bumper. And then we had word of a problem, possible brush fire southbound 5 at the 405. So if crews are on scene, that probably too is adding on to the mess. Newhall Avenue, bumper to bumper into Sierra Highway in the 14. Sierra Highway southbound side, also heavy. Typical delays from Friendly Valley now all the way down to Newhall Avenue. All right, taking a look at your hometown station weather. What a gorgeous day it is going to be. We are looking at sunny skies. We are looking at temperatures in the mid 80s, maybe upper 80s. And right now it is 62 and sunny right here in Newhall.
98.1 FM and AM 1220.
Hi, this is Dr. Palucki, and for most of my adult life, I was fat. And even though I tortured myself for years with diet and exercise, I always had another 20 pounds to lose. But in the past 3 months, I lost over 15 pounds and more than 2 inches off my waist permanently because I found the easiest diet and a new non-surgical permanent fat reduction technology. Go to LipoFree Easy tab on thedrpalucki.com and schedule a free introduction.
7:40 on your hometown station, KHTS. It's the Hometown Morning Show with Tori and Kai.
Make sure you go.
Oh!
To hometown station.
To hometownstation.com. I can't.
For all the latest.
I can't with you.
And greatest.
Can't.
Speaking of the greatest.
This one is the greatest. It's Jaimie. She's here. Dr. Jaimie's here from Cinema Vet to talk. What are we talking today?
Vaccinations.
Okay.
Because all the kids, as you know, because you have all the kids.
I have the bunch. Yeah, I've got a bunch of them.
Need vaccinations. Every year they need different vaccinations.
Yes.
So I bet our pets do.
Yeah.
I think the most popular or the most well-known is the rabies shot.
Rabies, okay.
Because I think you need your license for that.
There's something called parvo that you want to avoid.
Parvo.
Right?
I don't know what that is.
I don't know either, but I know it's bad.
I know that I'm very proud of you for even knowing that.
Yeah.
So let's ask Dr. Jaimie about yearly vaccinations, what we need to do and what we need to remember, especially for puppies.
Yes. Hey, Doc, how are you?
Hi, good morning. How are you guys?
We're finished. We're finished being silly. Now we can, so let's start with parvo. What is parvo? We seem to know the name parvo. It seems to stick in our, what is parvo?
It's a virus. So it's parvovirus. Mm-hmm. It's a disease of dogs. Mm-hmm. It's a very serious disease. It can be deadly. So that is why it's so important to vaccinate for it. Mm-hmm. It's a disease we see more so in young dogs and puppies, but any age dog can certainly get it, especially if they haven't been vaccinated.
Is there a reason for that the puppies?
I think their immune system is just a lot more sensitive or naive, and so they more easily will get it. Mm-hmm. But again, if your older dog has not been vaccinated, they still could get it.
Gotcha.
So when we do see parvo, it's typically pretty severe. It causes diarrhea and sometimes vomiting. Mm-hmm. Diarrhea can be so severe to the point that we see a lot of blood. They typically, if they're not treated, and even sometimes with treatment, they can die from it. A lot of times from just overwhelming illness and dehydration. Mm-hmm. So with vaccinating, that takes the risk away almost 100%. Not no vaccine can be absolutely 100%, but without it, it's a very serious problem. So with puppies, we typically do a series of 3 vaccines in their first year at a specific schedule. We usually start around 8 or 9 weeks of age.
8 or 9 weeks. Okay, so I buy a brand new puppy.
Yeah.
And then at 8 or 9 weeks, we bring the puppy in. Do we bring the puppy in prior to that, just to get an overall health check, or do we wait until those shots?
You can certainly, but even if we see them earlier, we'll wait until that 8 or 9 weeks to give the first vaccine. And then it's on a schedule, so we typically give about 3. So it's spaced out about 3 to 4 weeks apart until they're about 16 weeks old. And then they're done for that time. We booster once in a year. And then after that, for adults, it's only every 3 years that you need to be boosted for it. So
are any of these by law that need to have happen, to get a, I think rabies
is the only one required by law
to get the license, yeah, right?
Correct, yeah. And so there are times where the county will come knocking door to door and, ask to see proof. So rabies is required by law because it's obviously something that people can get as well, and it's a 100% fatal disease, no matter what. So,
what does that mean? 100% fatal? Like if anybody gets
if you contract rabies, you will die. Whether
Well,
you're a
good
dog
morning.
or
Good
a
morning
human.
to Dr. Jaimie Ronchetto. Seriously?
Yeah.
And the dog, and obviously pets will obviously.
Yes,
This is just fatal. It's completely fatal for anybody.
It's a fatal disease, yeah. And so that's why, rabies eradication programs are so important in developing countries and all of that, because it's a problem. Like, we hear about it in the news every once in a while, that, a bat or a cat or whatever tests positive for rabies.
Right.
There may have been human exposure, and that could typically not even be a bite. Sometimes it is a bite wound, but other times just exposure to saliva can still cause a problem, and that's why they need to go for prophylactic treatment, because if it's not caught early, you will die.
It's okay. So I'm not quite sure that we have been taking the whole rabies thing as seriously, maybe as we should, even though it's necessary to get the license. And you need the license. I recommend you don't go without a license because your pet could be taken away.
Right.
Does everyone come in for the rabies? Like, is everyone really diligent about this?
I don't see too much pushback with at least rabies. Other vaccines, maybe they don't want to do it, and that's fine. That's their, I just try to educate as much as possible on what we vaccinate for and why, and it's up to them if they want to continue doing it. But rabies typically does not get any pushback.
Is there a vaccination that you suggest that maybe isn't even like on the list of the norm? Is there something outside of the box that maybe you would recommend?
It just depends really on, especially for dogs, it depends on their lifestyle. So there are some vaccines that are not considered core vaccines that every single dog should get. But if you have a dog that goes out with you all the time, let's say camping or hiking, or goes different places where they may be exposed to more wildlife or standing water, then, like a leptovirus vaccine may be necessary, or a Lyme vaccine may be necessary. But for our typical dogs that are mostly indoors in the middle of the city, they probably wouldn't be necessary.
Older dogs. So let's say, okay, we talked about getting a puppy. Let's say I adopt an older dog, and I have no idea of the history at all. Where do we start? We bring the dog, obviously, or cat to you. And where do we start as far as these vaccinations?
So if you have no history at all, then we basically start as if they have not had vaccines, which isn't going to hurt them if they did at some point in their history. It's just better for us to be safe rather than sorry.
So there's no problem in over-vaccination.
Yeah, I mean, I know over-vaccination is used a lot in, talks and everything, but at least in my practice, we are definitely conservative, and we go by, guidelines that have been set out. So we don't just sort of vaccinate willy-nilly, but we do want to make sure that that animal is protected. So let's say an older dog does come in, we have no vaccine history, we would probably give them a booster of each vaccine that we recommend, all of the core vaccines and certainly the rabies. And then, depending on the situation, we may booster in a year rather than waiting 3 years, since we don't know what they've had in the past. And that certainly isn't over vaccinating. It's just being
cautious.
Cautious, exactly.
Fantastic. Yeah. So one question before you leave has nothing to do with vaccinations.
Okay.
My dog, Sugar. I've shown you pictures. Okay, so Sugar's 12 years old, going to be 13, still great. It doesn't have the hearing. Hearing's completely gone. We've tested. Okay. It's not selective, and her hearing is completely gone. And lately, she has she digs at the couch, she digs at her dog bed, she digs like she's gonna bury a bone. Now nothing's actually moving. Obviously the couch, the cushions on the couch stay in the same place. It's not like she's fluffing anything up, but it seems like she wants to dig. Is there something as an older dog why this would happen?
That's interesting. I don't have a great answer for you, except that she is older, so she's considered a senior. And if she's doing new behaviors that don't really seem to make sense, older dogs can get senility. So it could be a little just bit of older dog confusion. You know, if she's not actually trying to bury something, she doesn't have a treat or anything like that. Could be a little confusion.
Just old age, huh?
Yeah.
Just little old age. We have to, okay, I'll get her ARP card. Dr. Jaimie, thank you so much. As always, such a pleasure to have you in talking about all things dogs, cats, and pets. Driving around, someone says, yeah, you know what? I need a vet. I just got a puppy. I need a new vet. How can we reach you?
Yeah, our phone number is 661-253-9300.
And the website?
The website is cinemavet.com.
Because you're on?
We're on Cinema Drive.
There you go. It's as easy as that. Dr. Jaimie, always a pleasure. Thanks for being here.
Thank you.
Beep, 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 beep. Go!
All right. So, I have an older dog. A senior dog. What are you going to do? All right. Let's check traffic. As we do on the 8s every 10 minutes, southbound side of Sierra Highway, a little bit heavy into Golden Valley, but then it does clear up. You have some congestion into Plaza Rita, and then it does get heavy into Newhall Avenue because I'm thinking we had problems on the 14, and the 14 is just bumper to bumper right now coming away from Sand Canyon, and that is all the way into the 5 freeway because the 5 has trouble right now. Several problems. One at the 210, one at the 405, and even south of the 118, still extremely heavy.
Oh, yeah! The Hometown Morning Show with Tori and Kyle. Your hometown station. 98.1 FM and AM 1220.
Come on!
This is Cardinellis, host of Problem Solver Politics.